All right, good evening and welcome here. I have Sherry Weller with me tonight. My name is Dr. Julie Hinman, and we are hopping on to talk about safe supplement use and share some of probably the most common questions that I get asked inside of my practice. And actually, even on the street from clients who are just wanting to know, what should I be taking? Should I be taking anything at all? Is this safe? Do I really need supplements? All of those questions. So we're going to talk about those this evening, and also highlight some of our favorite products. So Sherry, we're going to get into the introductions. I'm going to go ahead and share my screen and just get started in the slides, and then we'll work on introductions. This was a live event. If you have any questions when this is posted inside of the group, feel free to link those in the comments. Either myself or Sherry can answer these questions inside of the group. And if you're watching and you want the stay until the end replay and bonus, then also make sure you put your name in the comments so we can get that stay until the end bonus over to you. All right, so let's get sharing here. Okay. All right, so again, welcome to our webinar this evening. Tonight we're going to discuss some of our top tips for safe supplement use. And we're going to answer again questions like, are nutritional supplements really necessary? How to find and choose high quality supplements, among many other really interesting topics. So our objectives tonight, we're going to talk about supplement safety. We're also going to talk about some topics like quality and safety standards, including things like product testing and contamination and what that means to you and why you should be concerned about it. We're also going to talk about the research, because everyone's probably seen some conflicting research when it comes to supplements. So we're going to talk about what the research really does say and what you need to know about it. And then, of course, at the end, we're going to give you our top 5 supplement recommendations. And again, that stay until the end webinar bonus. So my name is Dr. Julie Hinman. I am a family nurse practitioner by training and the founder at Soul Wellness and the Complete Metabolic Reset. I am traditionally trained, but I'm also certified by the Institutes for Functional Medicine and the American Academy of Nurse Practitioners. Sherry, I'll let you go ahead and give yourself an introduction as well.
Sure. I have been in the wellness industry for a little over 17 years. It's funny because my background is corporate America, and I actually for 7 years worked for a big beer and beer tobacco company, the furthest thing from health and wellness that you could possibly imagine, and fell in love with wellness and nutrition about 17 years ago. And I love partnering with people like Julie and just educating people, because there's so much information out there.
Excellent. Yes, that's wonderful. And I think so. One of the things that Sherry and I connected on initially when we met one another was her knowledge and experience inside of the supplement industry, understanding what is happening with supplements from when they're, sourced to the packaging, really understanding the whole process has been wonderful. And so it's been really great to be partnering with Sherry and to really be including her inside of our team at Soul Wellness so that we can bring really great quality supplements. So I'm excited to have this collaboration and talk about this more. So just a little bit of background. I've been hosting this supplement webinar for about the last 2 years because I talk about the topics that I get asked about the most, and I want to make sure people have the right information. They want to make sure that they have their questions answered. And so supplements are definitely one of those areas where there is so much conflicting information when it comes to supplements, what you should be taking, which brands you should be using, and they're marketed really heavily. So it's hard to know what is what as a consumer. Sometimes it's really even hard as a healthcare provider to know and to be able to really dig in and figure out, is this something that I would recommend for my patient? So the supplement industry is an industry. It's worth $151 billion globally. So there is a huge market. People spend a lot of money and invest in their health. And one of the areas that they invest is inside of products, right? Sometimes it's nutritional products to help overcome a condition. Other times it might be that they're looking for a supplement to help with weight loss. That is another big industry. And that's okay. There are many, many billion-dollar industries out there, but one of the challenges with the supplement industry is that it's not regulated, right? And that's both, it's not bad, it's not just bad, but it's not necessarily good either. So because the supplement industry is not regulated like you would see from like the Food and Drug Administration, it means that anyone can put a supplement on the market without any testing, without anyone double checking the claims that they're making. So, Sherry and I could go to our kitchen later on this evening and we could take a few supplements out of the cabinet and we could just mix them together and we could say, this supplement has been great for my arthritis, right? And then we could start marketing that. We could even put together our own research. So you just have to be aware that there's nobody really watching out for the consumer when it comes to supplements. So it's your job to be well informed. And again, that was really the reason why I put together this webinar 2 years ago, and I'm still giving it 2 years later. So there's no quality or safety assurance. It really is up to the consumer to make these decisions. And you might say, well, why? Why is there no research? Why is there really no one looking out? And I'll tell you, one of the big reasons from a government perspective is that there's just not a lot of money, unfortunately, in studying medicinal plants and supplements. Like, it just doesn't make anyone money. And people who fund the research are typically the drug companies, right? Drug companies, sometimes you'll see government funded studies, but research on supplements is typically underfunded, and it can sometimes be, when we think about it from a research perspective, it can be a poor study design. So that's just a little bit of background. So when it comes to what the research really says about supplements, are supplements really necessary? And don't I get enough from my diet? So oftentimes we really want to make a point here to say that we should all be eating better when it comes to our nutrition. We need to be eating whole foods. We need to be eating enough servings of fruits and vegetables. But for the majority of Americans, actually, it is a very slim majority that is actually getting all of their nutrient needs. And they're actually not getting all of them, but just based on the foods that they're eating. And that's for a number of reasons. That's because of our soil is now depleted of nutrients like minerals. Our food has less vitamins than it did even 50 years ago. If we were to compare like a carrot today to a carrot 50 years ago, it is just not the same, unfortunately. And so oftentimes it means that we really do need things like maybe a really great quality multivitamin or specific minerals or vitamins to really boost what our body needs. It also is because we have higher levels of toxic exposures inside of our life today. And so we oftentimes need a little bit more of a boost to help our body naturally detoxify. It does that naturally, but it does need support in doing so. All right. So the next thing here is just really that the supplement recommendations should be specific to what your individual needs are. So gone are the days of just like going to the health food store and just like taking a bunch of random stuff and really hoping that it works. We want to be really targeted. And I would say really in the last decade that supplement research, or that's we have more knowledge now than we did 10 or 20 years ago. So we want to really be specifically targeting what types of supplements we're using and be using them for the condition or our personal need. Another big piece that I want you to be aware of as a consumer is just how to use supplements safely. And as a healthcare provider, I think one thing that I find a lot is that maybe my patients or clients, they aren't necessarily disclosing what types of supplements they are. Less so now in functional medicine, but in traditional medicine, people wouldn't tell me if they were on a multivitamin. They wouldn't tell me if they were on, vitamin C, or if they were taking zinc. And maybe it was just because it was more information to write down in the paperwork, or they didn't think that it was important for me to know. But there are some health conditions and some prescription medications that can interact with your supplements. And so you want to make sure that your healthcare provider, that your pharmacist knows, and that you're just aware of the potential for interactions. Although they're common, they do exist. So we just want to be cautious, especially if you have conditions like a clotting disorder, a bleeding disorder, or you're taking um, any medicine for mental health reasons. And then the last reason is pregnancy and lactation. Obviously, anything that you consume, whether it's food, alcohol, drugs, supplements, has the potential to cross the placenta so that baby gets some of that exposure. We don't have a lot of research and data on how supplements affect uh, infants before they're born. So we want to be just cautious about the types of supplements that we're using. And the same thing goes for breastfeeding mothers. So be cautious. And if you are a health coach and you're watching this, if you have a pregnant female or a nursing mom, I think it's always best to include the healthcare provider in the decision so that they can look to see if there's any research on the specific supplement and also help that mom make those decisions. And then the big one, which I'm excited that Sherry's going to share some information here. Poor thing, she's been so quiet and patient here as we've been talking, is that we want to make sure we find a reputable source. So this is a huge, important piece. And so one of the quick stories that I want to share is a story from when I was wanting to get pregnant with my first child. And I had mentioned this at my OB visit, and they're like, well, you should really start a prenatal vitamin. I said, okay, that's great. That's actually, we need to start that about 6 months before we get pregnant if we know we're going to do it, because of the folic acid and all of the other vitamins and minerals. And so they sent me home with some samples. And Sherry, I don't think I told you this story, but I took the product home and I opened it up to take the first vitamin, and it was like bright pink. So I looked at it, I'm like, that's weird. Like, why is this bright pink? And I turned over, and not only were there just a ton of extra additives and fillers, but there was also like red dye. I think number 40, right? And so that is mind blowing. Here we have a woman who wants to get pregnant, and we know that red dye number 40 is highly, is associated with cancer risk, right? And so we're giving this mom and this newborn baby like all of these other like chemicals. It just doesn't make any sense. So we really want to look at the labels inside of our products and know what we're taking, and just be a cautious consumer and ask questions. So needless to say, unfortunately, I don't like throwing things in the trash, but that went directly in the trash. I was not going to take that vitamin. And so I think that it's really important that we do our research and then ask questions. So ask questions of the company, ask questions of the reps. If they can't answer your question easily, if they don't know the background on how their products are being tested, what their quality standards are, how pure are the ingredients, where are the ingredients coming from, then you probably want to choose another company, and really make sure that you kind of avoid some of those sketchier products. There's some that are just pretty sketchy out there. And then the other thing too is, everyone likes to cite the research study. They say, well, most vitamins and minerals don't have what they say they do. And that's actually true. So most of what you buy over the counter from, like, let's say you go to Walgreens or you go to Walmart and you're buying a supplement, I think it was 99% of the supplements that were tested had none of the actual ingredient that they were looking for. And of the percentage that did have a measurable amount, like let's say we're testing vitamin D, of those that said they had vitamin D or they said they had vitamin C, they didn't have anywhere near the amount that the label stated. And so the point is like, how much money are we wasting? And we're taking extra stuff that we're just really not getting the benefit from. So I would avoid purchasing any supplements from the big box companies or from even the pharmacies, because they just don't have the quality and purity. And we've seen that time and time again. Study again are showing that those supplements are just not even worth your time. So Sherry, I feel like I zoomed through that. I'm going to let you lead in, and you just let me know. I'll control the slides. Is there anything that you wanted to touch on, or is anything that you wanted to kind of bring up that I've already kind of mentioned, or do you want to move through your slides?
Well, a little bit of both. I mean, I just want to really echo some of the things that Julie was talking about. First of all, our food sources aren't what they used to be. So in the past, when people would say, do I even need supplements? Julie and I would probably have said, no, eat your whole foods, you'll get enough nutrition. But the truth is, we just aren't getting enough nutrition. Even if we're getting organic, um, we still need some kind of supplementation. And so that was something that I think was really important when I started in this whole nutrition realm. I had never taken vitamins. I had never taken supplements, and I thought I was perfectly healthy. But I will tell you, as soon as I started taking certain supplements, it was life changing. And just for energy, for mental health, for everything, I think it's really important that people are aware that taking good supplements will help, but you still want to have that clean whole food diet as
Mhm.
well, to complement it, because you can take the best supplements in the world, but if you're still going to fast food, you're still going to have some issues. So the supplements can only help you if you help yourself as well with your food choices. So that was one thing. And then, as you were saying, it's so important to check the quality. I don't remember what the percentage is, but I had heard 80 to 90% of our supplements end up in the sewers, meaning they go right through us without ever absorbing the nutrients that we need. So again, that's why it's so important to look at testing, to look at sourcing. And I'll just share a little bit of my story with Q Sciences. I've been recommending nutrition and supplements for the past 16, 17 years, as I mentioned, and was introduced to Q Sciences a little over a year ago. And honestly, when I looked at them, I was so blown away. And one of the reasons is this sheet right here. I know you're probably not going to be able to see it right from the screen. So if you want to mark in the comments, I want a copy of this, we're happy to send it to you. But the quality assurance standards that this company uses before they ever put out any of the products was really, really impressive to me, from packaging and the way that they take care of everything on the outside, but even more importantly, for everything that's on the inside. Multiple certifications, multiple third-party testing. The little QR code there is for all of the hemp products. We're not going to be talking about that tonight, but they're all sourced and they all have individual codes so you can track them back to their sourcing. So that was just really impressive. All the testing that they do, the safety that they have. And then they've been doing this for a little over 10 years. And in my opinion, over the last year, they just keep getting better and better.
Well, that was one of the things that stood out the most because as a healthcare provider that recommends supplements, I am often sold a lot of supplements because people want me to talk about their brands or to get behind their brands. And I'll tell you, I've had other brands reach out and I've asked questions or asked about third party testing or where is your protein coming from? Like, where are the cows that you're getting these things from? Are ingredients coming from China? How do you know that they're not contaminated with things like one of the common things is heavy metals, right? Potentially pharmaceutical drugs can be inside of your supplements. You have no idea. And if they're not able to answer me quickly and show me this information, then I just move on. And that's why there really is only about three to four brands that I will recommend depending on the product. So when Sherry showed me this, I was like, wow, this company really, not only do they say that they stand behind their quality, but they actually are able to show their processes and show the quality and really assure it. And I think that it speaks volumes. And for me, again, was a really big step in recommending or adding another supplement brand to my list that I was recommending.
Perfect.
All
Go
right.
ahead and move on. So I'm going to start with one of my favorite products. Julie talked about the importance of taking a multivitamin. And again, how do you even choose? There are so many on the market. And one of the things that is so important to look at when you're looking at a multivitamin is it all in one capsule? Because if you think about it logically, there is really no way that you can put all the nutrients that you need in one little capsule. Yes, companies do it, but are you getting the maximum nutrition? When I talk about effective dosage, that means that you have all of those ingredients, but it's spread out in several different capsules, several different times during the day. That way, your body knows what to do with it and it can absorb the maximum potential that is available. And that's really what bioavailability is. It's, is your body using what it needs to at the right times? There are a lot of buzzwords out there with vitamins, methylated, chelated, all of those types of things. And Q Science Products takes all of those things into consideration. One of the things that I like to look at is, especially if you're taking a capsule, what kind of capsule? I prefer vegan capsules because they absorb quicker. A lot of times you'll get the gelatin capsules and your body has a very difficult time breaking that down, or a lot of bodies do. And so again, when your bodies can't break down what's in the supplement, it typically goes through the sewer. So I would look on the back of the label and just see if it says vegan. Go ahead.
You can ask your nurses. We find those capsules in people's poop in the hospital. And it's like, wait a second, this came out looking exactly the way that it did when I gave it to you, 8 hours ago or 12 hours ago. So yeah, super important that you're able to break down that capsule. You're absolutely right.
Absorption is key, because if it's not absorbing, you're not getting anything that's in there. And you can even do a test. Take a vegan capsule versus a gel cap, put it in some water and just let it sit. I mean, your gel cap may be sitting there for a couple hours. And when you're doing, taking vitamins, you want them to work instantly, if not within the first 30 minutes. And so they pass that test. The core vitamins, it's an AM and PM packet. So in the AM packet, you get a multivitamin that also addresses brain health, focus. There's inflammation in there as far as inflammation support. Not that you're going to get inflammation, but it helps alleviate inflammation. And then my favorite is gut health. Your immune system, your serotonin is in your gut. So I always tell people, if you want to be healthy and happy, you've got to be on a really good pre and probiotic. So this product has that in the AM and PM packs. The other thing that I love about this, it works at the cellular level. So people who use this product see an almost immediate difference. I mean, I could talk all night just about some of the great testimonials I've had on this product. I'm going to share one, and it was one of the first people I shared this product with. And she has had arthritis for years, hasn't been able to close her fist. She works in a preschool, so she's on the floor a lot with the kiddos and is always in pain. And the supplement in the pack for the anti-inflammation, after a week, she said, "What is in here? Because I could make a fist now." And, you know, stories like that just warm my heart, because I know they're helping people. The Mind Health product breaks the blood-brain barrier, so focus, mental health, just your brain health is affected as well. So can't say enough great things about these. If you want more information, just make a little comment. Happy to share more on this one.
Awesome. Did we miss a slide?
And then, what's that?
I thought we might have missed a slide there. Go ahead.
Did we miss the oral sprays
I think it's the next one.
or the sprays? Okay. So protein is a supplement as well. I think a lot of times when we talk about supplements, we talk about capsules and vitamins, but supplements include things like protein, because most people don't get enough protein during the day. And I typically recommend at least half your body weight in grams of protein a day. And if you're an athlete or if you exercise regularly, up to 75%. And for most of us who are busy, we don't have enough time every day to make lean protein meals. And so having a convenient protein powder that tastes good, but also has vitamins and nutrients in it to help you get through your day is really beneficial. And these protein powders, you have your option. There is the vegan protein, which is pea protein. For a lot of people who have lactose intolerance or just have gut issues from too much dairy, the vegan is a great option. They come in the individualized packs, chocolate, vanilla. They're delicious. You can use them as a meal replacement. And then there's the traditional whey protein as well. Very clean whey. It's pasture raised cattle. And again, multiple flavors. The products have fiber. They do have the digestive enzymes. So even if you do have some tummy issues, the digestive enzymes do help with that. Pre and probiotics, there's some B vitamins. Whey protein is great for muscle recovery and for building lean muscle. And then the thing that's, I think, really unique, especially if you start looking at ingredients in protein powders, there's no sugar in these. And they still taste delicious. They taste sweet, but it's not from any added sugar.
Awesome. So this is one of, so when I send clients to Sherry, it is oftentimes like, this person needs protein powder because, you know, you're right. I've never have had anyone come to me for health or for weight loss that has been eating enough protein. And so typical recommendations are about half a gram to 1 gram per pound of body weight. So, and for most people, especially women who are looking to lose weight, we're closer to that 1 gram per pound. So 120 pound female or 160 pounds, then we're looking towards that. And that's almost, actually, it is impossible. I can't even eat that much protein in a day without using some kind of supplement. And so, again, we want to look for quality, and this definitely hits the bar. If you go into GNC or into any supplement store or just Google protein powders, they'll have really great marketing with some really fit looking people on the labels, who likely are not using those products. But the product, we don't know where it's coming from. And so this was the big, gosh, I would say about 15 years ago, the research came back from a Shakeology, and I'm going to say it because they were the ones who were named, were contaminated with heavy metals. And so we're all doing this because we want to be health conscious and health forward. But unfortunately, like if we're getting a dose of heavy metals, like what is happening to our bodies? We're trying to detoxify at the same time we're getting some of those extra ingredients. So this is super important that your protein powder comes from the United States, is more likely to be contaminated if it's, well, I should say that it should be coming from the United States, Europe, and then some. New Zealand also has some really healthy quality cattle, where you're getting the whey protein. But unfortunately, when products are shipped from China, they're more likely to be contaminated with heavy metals. And so if you don't know the source and the ingredients, it is likely that your protein powder may be contaminated, and you wouldn't know it. You would have no idea. So, all right, Sherry, I'll turn it back to you.
Yeah, there are a lot of fillers out there in protein powders, especially over the counter. And then the other thing I wanted to mention about protein, there are a lot of protein powders out there that say 45, 50 grams of protein. I'd never recommend more than 30 grams in one sitting. Most bodies can't use all of that protein in one sitting. Our bodies can handle about 25 to 30 grams at a time, let it digest, and then move on.
Yeah, the question is really about how much can we digest at once, and you want to spread that out over the day. You're right. You don't want to just eat it and then it doesn't get absorbed and digested and utilized, built into your protein needs. So very important point.
Okay, wait. the other way.
Oh, I'm sorry. There we go.
All right. This is one of my favorite products. And one of the things that I think I was so excited with Q Sciences, they are just very innovative with their products. And these are spray vitamins. So if you are one of those types of people who struggle with taking capsules during the day or the big tablets, sometimes we call them horse pills because some of them are so big. This is an awesome alternative. They are spray vitamins, so they're sublingual. They go directly under your tongue. They taste great. But again, when we talk about that bioavailability, this technology in the sprays, it absorbs almost immediately. And they're portable, they're affordable, and they're just kind of fun. They they make a great statement, but it's easy to use. And if you are someone who struggles with getting enough vitamin C or vitamin D or B12, some of those other vitamins that aren't necessarily in a multivitamin, these are great supplemental vitamins and super easy to use.
So I absolutely I love these, and partly it's because they are so convenient. I have my cup here with my pens in it, and my vitamins are in there, and I don't ever forget them because they're visible all day long. The other ones that are kind of on the countertop in the kitchen, I oftentimes will forget. But they are just as good as Sherry mentioned. They are probably one of my favorite products. And one of the points that I want to make, for people who are coming and getting like vitamin B injections, this vitamin B12 spray is something that you can easily tuck in your purse. And this was one product where the first time I noticed it, I actually did notice an energy boost when I used it. The other point I wanted to make with the vitamin D3, in all of my years of practice, I have, and especially when I was working in traditional medicine and traditional primary care, not a moment went by that I would check a vitamin D level and would have somebody that had appropriate levels of vitamin D. So the standard for vitamin D dosing is about 4,000. Excuse me, it is 4,000 IU's um, per day, in order to get an adequate vitamin D level. And we know that the research on vitamin D is very, very strong. People with low vitamin D levels are more likely to have inflammatory autoimmune conditions. They're more likely to have cancer. They're more likely to have heart disease. And so we know that this is one vitamin that is like a multivitamin. It is like an absolute must for all of my clients. And sometimes if we can start you on a dosing and then see how your labs do, and then sometimes we back off. But typically, most people take about 4,000 IU's very safely, and you can notice a huge improvement. I've had people come in with fatigue and all types of terrible symptoms, and it's not that it's just related to their vitamin D, but getting them on appropriate supplements and supplementation can really help to correct some of those symptoms that they're having. So I love these. Last point I'm going to make is the reason why sublingual is amazing. And so you may have used a medication before or take, nausea medication is one of those medicines that we give underneath the tongue in medicine. And the reason being is, think about how vascular, how much blood flow there is through your mouth. And so when you put these medications under your tongue, they are absorbed into your bloodstream and they actually start circulating immediately. And it has this really cool effect that the liver is one of our filtration systems. And when you put medication underneath your tongue, it actually bypasses the liver. So you get a complete systemic circulation of the vitamins that you're using like this, one full round before it hits the liver, and the liver has a chance to remove these. So it is very, very effective and very efficient, and it's a very cool product that I really enjoy having on my desktop next to my computer screen here. All right. Any other points you wanted to make on these, Sherry?
No, I think you hit it all.
Awesome. Let's see
Yeah, I mean, the nice
here.
thing is there's no capsules, so your body
Yep.
absorbs it much quicker. And then the last thing I wanted to talk about, greens. Most people, again, do not get their daily allowance of greens. And even if they do, the quality isn't where it used to be. And unless you're somebody who loves meal prepping, again, washing and chopping vegetables, most people just don't get enough. And this product, I have tried so many greens because I'm one of those people. I do not love washing and chopping and getting all my veggies in order, although I love eating them. But it's very time consuming. And so this product has 20 superfoods all in one little packet that's very convenient. But what is different about this product? I mean, greens are great for so many things, and a lot of greens offer, support for digestion, support for detoxification, support for energy, support for muscle growth. There's a lot of things that greens do, whether it's, the regular vegetables that you eat, whole foods, or whether you do a greens powder. For me, however, most green powders taste like grass or taste like chalk. And so I was a little skeptical when I tried it. I'm like, okay, this is just another greens drink. But I will tell you, this is not just another greens drink. It is delicious. It has an apple cinnamon flavor. I don't even need to mix it with anything. It is kind of my go-to every morning. There is some natural caffeine in it, and it tastes so good. I could just tell that my body is getting what it needs. And if you do your fruits and vegetables in the morning, especially, it sets your day up for good digestion, and detoxification, and it helps your body get in a more alkaline state. I talk about alkalinity and inflammation a lot. If you think about a swimming pool, if it is blue, it is alkaline. If it's green and there's stuff growing in it, it is acidic. And our bodies are the same way. We just can't see if it's green, but we can feel it in lack of energy, maybe joint pain, headaches, that type of thing. And so having this first thing in the morning, I can just tell that my body is alkaline and I'm ready to get the day started.
Yeah, yes. And you can put this, I mean, it's great, as Sherry was saying, just mix with water. But really interestingly, I have a 4 and a 6-year-old, and I have been actually putting green powder in their drinks for a long time, or just spinach. And so this morning, they did milk with some frozen fruit, the bagged fruit from Costco, and one of the greens powders. And so they're, it's a great way to get those extra nutrients and start giving them to them, at this age, and they don't even recognize it. They're like, oh, it's another green smoothie. Put a banana in anything and it'll make it taste really great. So definitely a great way to boost and add your nutrition. I think that, are you mixing it with some of the protein powders? Can you mix it with
Um,
protein powder?
it tastes really good with the vanilla protein, I think. And
Okay.
then there's another supplement that's a chai flavor immune support that I mix it with as well. And that tastes
Okay.
really good.
Awesome. Yeah, I mean, and a nice way to break up your water intake during the day too is to kind of throw in, 8 ounces with these mixed greens over ice. Makes you feel like you're having a treat. So,
Yeah.
all right. Well, Sherry, is there anything else you wanted to cover on those items there?
No, I just think that it's, again, so important to do your research. And, you know, I think when people start changing the way that they eat food and then add supplements on top of that, it's a game changer.
100%, yes. Especially when we can target like a deficiency of some kind, people can feel just leaps and bounds, uh, improvement in their health, and really correct underlying health conditions. So one of the things that we promised tonight was a stay until the end bonus. So if you are still watching, we appreciate you sticking around with us tonight, and we would both love to talk with you more. And so I have a meal prep guide, from start to finish, that includes not only how to prep and prepare for a week of whole foods and ingredients that are cooked inside of your kitchen, but also the recipes to go along with that. And Sherry, what do you have for us?
So I would love to have a little consultation and see what kind of goodies you would like to sample, and I'll send off a sample or two.
Awesome. Yes, I love those samples. Oh, and like Sherry said, we're happy to talk. So I think one of the most important things I know from Sherry, and the reason why we work so well together, is our goal is at the heart of your health. And so if there is anything that we can do to improve your health or help you get headed in the right direction, that is really the purpose and the goal of our strategy session. So my promise to all of my non-clients or people who are coming to me is that we host a 30-minute consultation. So if you're wondering if something like this might be helpful for you or what you could do to maybe help correct your health condition, feel free to send me a message on social media or send me an email or connect through my website. So we will get that back to you. Just make sure that you link or comment below any questions, or that you're ready for your stay until the end bonus.
Yep. And it's all about making those small little changes that over time will make a huge difference in your health.
You got it. It's like it's not a single supplement. It's definitely a journey to that end destination. Excellent. All right. Well, it was great talking with you today, and we will chat again soon.
Thanks, Julie.